Hi, this is a short presentation on spinal cord. Just the first 2 to 3 pages of spinal cord from Paul Braces. We all know that spinal cord case is one of the long case given for final year pages, medicine pages. So we'll quickly go into it. It extends from the cranial border of atlas. We know the first two vertebrae have name. The first one is called as atlas and second one is called as axis. So it extends from the, this is the atlas, this is the cranial border, this is the caudal border. That is the superiormost border is called as the cranial border. It extends from the cranial border of atlas to the lower border of L1. This is L1. So it extends from cranial border of atlas to the lower border of L1. And the tip of the spinal cord is called as conus medullaris. The tip is called as conus medullaris. The spinal column measures 70 centimeters. That is the vertebral bodies measures 70 centimeters, whereas the spinal cord is only 45 centimeters. It is because of this discrepancy in length between the spinal cord and the vertebral bodies. The lower part of the spinal nerves have to travel downwards to exit through the foramen, corresponding intervertebral foramen. And the spinal cord shows two enlargement. One is the cervical enlargement and another is the lumbar enlargement. Spinal cord will be like this. So there will be two enlargements. One is cervical and another is lumbar enlargement. The enlargement represents the part from where numerous nerves arise. That is, this part gives rise to the brachial plexus and this part gives rise to the lumbar plexus. This lies between C5 to T1 and this from L3 to S2. This supplies the upper limb, this supplies the lower limb. So there are two enlargements in the spinal cord. One is the cervical enlargement from C5 to T1 and lumbar enlargement from L3 to S2. There are 13 pairs of spinal nerves. Cervical 8, thoracic 12, lumbar and sacral 5 and coccyx 1. Totally there are 13 pairs of spinal nerves. Cauda equina. You have seen in the earlier slide that suppose this is your spinal cord. The nerve roots arising from here will go directly through the intervertebral foramen. Whereas the nerve root arising from the lower part of the spinal cord has to travel down to enter through the corresponding intervertebral foramen. So the lower nerve rootlets will be traveling down like this, and this part gives rise to a structure called cauda equina, resembling the tail of a horse. This is the cauda equina. This is the pictorial representation of the spinal cord and the column. This is your vertebral body, and this one is cut, and this one is the spinal cord. You can see that the lower cranial nerves have to travel down to travel through the intervertebral foramen. This one is called as the cauda equina, and the tip of the spinal cord is called as conus medullaris. So, coming to the relationship between the vertebral bodies and the cord. At the cervical level, both corresponds. That is, the C1 segment of the spinal cord corresponds to the vertebral body of the C1. So at the cervical level, both corresponds. Whereas the thoracic part, that is T1 to T12 segment, lies within T1 to T8 of the vertebral bodies. So up to T8, you can see in this picture, up to T8 here, your thoracic part almost ends. And lumbar part lies between T9, T10 and T11, and sacral part lies between T12, L1 and L2. So these are the anatomical relationship between spinal process and the cord. Cervical level corresponds, the thoracic part lies within T1 to T8, lumbar segment between T9, T10, T11 and T12, L1, L2 corresponds to the sacral segments. Coming to the spine, because we cannot be palpating the vertebral body, we will be feeding only the spines of the cord. In the cervical region, as usual, it corresponds. In the upper thoracic, there will be 2 difference. Then in the lower thoracic, it will be 3 difference. And T11 spine corresponds to L3 segment, and T12 corresponds to S1 segment. T11 corresponds to L3 segment. These are some important landmarks. The spine of the T vertebra, T11 vertebra, underneath it you will be having the L3 spinal segment. So on cross section, spinal cord will be looking like this. There will be a ventromedial fissure. This is the ventral part, this is the dorsal part. There will be ventromedial fissure, dorsomedial sulcus, dorsomedian sulcus, and dorsolateral and ventrolateral sulcus. So there are 5 sulcuses and 1 fissure, ventromedian fissure. You can see this is the fissure, and this is one sulcus, and this is one sulcus where the dorsal nerve roots enter, and this is the ventrolateral sulcus. You can see the head-shaped gray matter within the spinal cord. In the central part there will be a central canal. On cross section it appears like it will be having a head-shaped gray matter surrounded by white matter. The 2 lateral columns joined by lateral commissure. So this is one lateral column and this is one lateral column. These are joined by a commissure. The central column is placed in the central commissure. Apart from this, there will be an extra projection here, which is called as the intermediate lateral gray column, which is usually seen between T1 to L2, corresponding to the sympathetic outflow. And similar type of projection will be seen in S2 to S4, corresponding to the parasympathetic outflow. Microscopically, it is divided into 9 laminae. In some textbooks it is given 10, but Paul Bussi says there are 9 laminae in the gray matter. 1 to 6, suppose this is your gray matter. 1 to 6 laminae lies here. The 7th one is at the bending, that is in this region, and 8 and 9 will be here in the ventral horn. So 1 to 6 in the dorsal, 7 in the junction, and 8 and 9 in the ventral part. There is a special zone called as the lizard zone. Actually the spelling is wrong here. It is Lissauer, lizard zone. And this part, this is the ventral dorsal column. This is the dorsal surface of the spinal cord. So a region, an area of white matter between the dorsal horn and the dorsal surface of spinal cord. This region is called as the lizard zone. It separates the dorsal horn from the surface of the spinal cord. So here you can see the 9 laminae, and the central one is called as the 10th laminae in some textbooks as well as in some websites, but as per textbook, our textbook, it is 9 laminae. The white matter is divided into dorsal funiculus. So far you have seen the grey matter, the white matter. So the white matter will be like this. This is your grey matter, this is your white matter. So you can divide each half into 2. So this is one half, this is one half. So up to this one is called as dorsal funiculus, lateral funiculus, and ventral funiculus. So each white matter is divided into dorsal funiculus, lateral funiculus, and anterior funiculus. Arrangement of fibers, just simply remember in the posterior column S will be in the medialmost, whereas in the anterior part S will be in the lateral part, that is sacral region. Just remember like this, the dorsal column S will be in the median central, whereas in the anterior part, lateral and ventral part, S will be placed in the lateral part. Blood supply, it is done by anterior and posterior spinal arteries. Anterior spinal artery is a single artery which supplies the anterior 2/3 of the spinal cord, whereas there are 2 posterior spinal arteries. Both these anterior and posterior spinal arteries arise from the vertebral artery, but in some persons the posterior spinal artery can arise from the posterior inferior cerebellar artery. And in between you can have the radicular arteries, which are direct branches from the aorta, which feeds this anterior and spinal artery, of which some are very important, and one such artery is the artery of Adam-Kiewicz. Based upon the blood supply, it is divided into cervicothoracic, mid-thoracic, and thoracolumbo-sacral region, of which the mid-thoracic is poorly vascularized when compared to the other 2 regions. That is, the T3 to T8 is poorly vascularized, and there is one artery, that is our radicular artery, arising from the aorta, which is called as the artery of Adam-Kiewicz. It usually enters and supplies between T9 to T12. Seldom it arises above T9. That is, it will not be seen at the level of T8, T7, T6 and all. Only between the regions T9 to T12. When compared to the white matter, the grey matter is richly vascularized, Thank you.